Hi, Dr. Gariba here again, and I'm starting with prostho questionnaires from today onwards. I was doing ethics questions. There are 40 of them, and I've finished 20, I guess. 20 are still remaining, but I'll take them again a while later. In the morning today, I think somebody messaged me on YouTube saying, "Can I do prostho questions?" And I was like, "Okay, why not?" Because prostho is also a pain point for many candidates, and I understand that. After I graduated my BDS, I could just understand the complete denture part and a bit of FPD and a bit of RPD. Nothing of cast partial dentures, nothing major in FPDs, and no tough CDs, complete dentures. Implants, forget it. So, but there is so much more to prostho that a general practitioner does. But obviously, prostho is such a vast subject that unless it's taught properly, it becomes very dry and boring. And unless you do the actual things, it's very difficult to remember because there are so many things that you have to do in it. So, anyways, you being a general practitioner, when you start practicing in Australia, for which you're going to give the exam, you're expected to know a lot more in prostho than what you're taught actually in the graduate schools. So, of course, the questions that would be asked would also be a lot more, right? So, I have like more than 500 questions on prostho, honestly. I have taken them from the textbooks recommended from ADC. This is the book that I have made recently and published. These are all the topics that I've taken from ADC recommended books, not just the standard textbooks. These are ADC recommended books. So, the questions are from these books, which means that you have higher chances of getting the questions and answers right in your own exam because they are asked from these resources. Honestly, it took me hours and hours of so much of hard work in preparing this book, but it is going to be so useful to you now that you want to see it. So we'll be starting today with the essentials of, not essentials, we'll be starting today from Fixed Prosthodontics by Rosenteil. There are 160 questions made out of this book, and then I have around 80 questions from complete dentures, and then I also have Stewart's removable partial denture. Again, we have 80 plus questions out there, and I have many more questions in my mock test as well. So anyways, let's start with Fixed Prosthodontics by Rosenteil. After we finish with this, we'll move on to Essentials of Complete Denture Prosthodontics. So I think the Rosenteil starts from page number 296. Anybody who wants to buy this book can email me on adcwrittenmocktest@gmail.com. Yes, Contemporary Fixed Prosthodontics by Rosenteil, Land and Fujimoto. Okay, so question number 1. Plan to solve 3 to 4 questions today. A 60-year-old patient presents for a full coverage crown on tooth 4-6. Full coverage crown, okay. The tooth has a short clinical crown. What is the most appropriate initial strategy to enhance retention? Retention, not resistance form. Retention and resistance form you have to read from Student. I know they may sound confusing, but it's actually pretty straightforward once you see what is there in resistant form in the preparation of a tooth for cavity or for a crown, and then the retention part of it. Resistance, if I have to give you a brief summary of it, it's basically related to the parallelism of the tooth structure when you prepare and the length of the crown. That is very important in resistance. Retention is how you're going to retain it, and that is by additional auxiliary things like grooves, like the cement that you use, the pins, all those come in retention. So now this question is asking what is the most appropriate, and always I tell you, whenever they use these adjectives, most, best, initial, that means all the options are going to be correct. But you have to choose the most appropriate one. It's like I have many friends, but I have to choose my best friend. So yeah. So what is the most appropriate initial strategy? So there are 2 adjectives here. Not only most appropriate, there is initial strategy, not the final strategy. So the initial strategy to enhance the retention. So use resin cement. Okay, resin cement is good. But is that my most appropriate and the initial one? Increase occlusal reduction. If I increase my occlusal reduction, I'm shortening the crown, and the question mentions that he already has a short clinical crown. So actually, I'll be creating more imbalance, right? So that is a wrong option. Use a shoulder finish line. Not wrong, you can use. Place auxiliary grooves or boxes. Now these would give an additional retention in the tooth structure itself. See, if I were to be confused, I would be confused between option A and option D. But option A is a resin cement. It's kind of a third party structure. There is crown, there is tooth, and the resin cement helps in bonding. Of course, it's a good cement. But I want a retention thing that has to be incorporated in the tooth itself, because that would any day be more stronger than any third party structure. Understood? So even though option A is right, the question is asking me most appropriate and initial strategy. Resin cement will become a later strategy. Initial strategy is what I'm doing to the tooth basically. So if you read the question properly, it's actually giving you out the answer. So what the question is trying to tell you is what are you going to do on the tooth which will help you retain the crown the best. And that would be place auxiliary grooves and boxes. Now you understand. See, when you start studying like this, then even the most dry subject like prostho will become very interesting, you know. I don't know if you all know, I had taken prostho as my postgraduate subject when I cleared my All India exam. I wanted pedo, but my dad was very adamant that I should not leave Bombay, the place where I've been raised. He's like, you're not going out of this place, you're going to travel by train and you're going to come back, you're not even going to stay in a hostel. Like, a very conservative family I come from. And I wasn't getting the pedo seat there because it went on rank 36th and I had rank 42, and so I had taken prostho. So yes, I did study prostho for 1 week before the second round of counseling was held, and then finally I got pedo and I said bye bye to prostho and I went to pedo. But why I took prostho? Because I still had the option of perio, oral surgery, and there was one more clinical branch here. But perio, no, I didn't want to do scaling. No offense to all the periodontists. Oral surgery, yes, but somehow I was not that keen for oral surgery. So if I had to decide between prostho, oral surgery and perio, then prostho was my obvious choice because I was good in complete dentures, in crown preparations. So I was like, if I have to take another branch, then might as well be this. Because I really enjoyed my prostho posting of 2 months that we were there in my internship. I did a lot of prostho work, and that increased my understanding a lot, and hence I don't dread this subject. So anyways, here we are, and like I said, if you're going to study like this, then you will also like prostho and you will not make mistakes and start fearing this subject. Okay, let's go to question number 2. The minimum occlusocervical dimension for an ideal it says, full crown on a molar is. Ideal, that means it has to be a textbook answer. 1, 2, 3, 4. 4. Occlusocervical dimension is the length of the crown basically. From top to bottom, how much should be the minimum length? Minimum, that you should not go shorter than this. Can you go shorter than that? Yes. If you don't have any option, yes. If the crown was already short, or there was a lot of caries, or it was decayed, it was fractured, blah blah blah. Yes, but ideally, the minimum thing that you want is 4 mm. Now this is something that you have to remember. So I would recommend take out your notebook, write this point, and you revise it every Sunday. That's how I used to study. Whatever things had to be just memorized because they were the standard rules, I used to write it in my notebook and I used to revise it every Sunday, all those points. Now, which factor is most critical when evaluating the resistance form of a crown preparation? Read the question, resistance form. And the second most important is most critical, not just critical. That means again all the options will be right. You have to choose the most critical. Again, who are your friends? All of them. Who's the best friend? One of it. Choose your best friend. Axial wall height, type of cement, margin location, tooth vitality. Tooth vitality is of no concern. Okay, so that is not a thing of my resistance form. You can do crowns on root canal treated teeth, so vitality goes out of the window. Margin location, supragingival, subgingival, equigingival. it depends, but still I would not take it as my most critical resistance form factor. Type of cement, that would come in retention, won't it? Axial wall height. Actually, this question is easy to solve because they haven't given much of resistance form options itself. But, like I had mentioned, the height of the crown is the most important resistance form. The longer the height, the better your crown is going to stay, because then it's difficult for it to be displaced in diagonal forces. You get my point? So, what is the minimum ideal requirement of a length of a crown? 4 mm. A provisional crown should ideally provide, in your exam paper, focus on these keywords: ideally, best, initial, final, most common, least common, except. These are the things present to trap you, to confuse you, but if you know your basics, it will be a piece of cake. So a provisional crown should ideally provide long-term retention, okay, but usually a provisional crown is given for short-term basis. Increased occlusal contact, no, it should just be an appropriate occlusal contact, not an increased one. Marginal leakage, oh no, I do not want marginal leakage at all. Gingival protection and aesthetics, yes, that's the job of a provisional crown. Provisional crown is basically a temporary crown which you give on the day of the procedure or a few days later, until your permanent crown is ready, because the permanent crown is going to be manufactured by the lab. Provisional crown, you can ask the lab to make it for you, or you can make it by those materials called as Luxar Temp or Pro Temp. So what is the function of that thing is to protect your gingiva and maintain the aesthetic, especially when it comes to the front crown. So provisional restorations protect the pulp, maintain tooth position, and support the gingiva. Understood? And okay, since I'm doing, might as well finish question number 5. Which is the most, oh my god, so many adjectives, aesthetic and biologically favorable finish line for an all ceramic crown? We all know for all ceramic we have a shoulder finish. Now it's a knife shoulder finish, it's a rounded shoulder finish, it's always a rounded shoulder finish to minimize the stress concentration on the margin area. Chamfer we use for PFM, heavy chamfer again the same. Knife edge, I don't think so anybody should use knife edge, but people do use that, but then it comes down to, I think, thin laminates. Rounded shoulder is for all ceramic crown because it needs that 2 mm of thickness. That material needs, because that much of thickness is needed for compressive strength. Compressive strength is, this is a material and horizontally I'm putting a force. So how much force will start producing crack on the surface? And tensile strength is this one, that somebody is shearing it like in vertical direction. So compressive force basically, in very layman terms, oversimplified terms, is a horizontal force, while as the tensile strength is kind of a vertical force, you know. So you need a certain thickness of material so it does not crack, and 2 mm is needed for all ceramic crown, correct? So yeah, and this is the answer given. So my book is full of questions from all the topics that I have just mentioned, and we have great topics, motivational interviewing, and you guys used to ask from where are these questions coming, and these are the places from where those questions are coming in your exam. Bell's oral and facial pain, I don't think so I've read this textbook in my graduation, but I ended up reading now to make questions for y'all, but it's an interesting read actually. Actually all the good books are a very good read. It's just that we didn't have that much of time or knowledge to understand so many things. Now having knowledge of the basic textbooks, now when you start reading these kind of books, it's very interesting actually. So yeah, I hope this processing helps you, and I will see you tomorrow again with the next 5 questions, okay? Have a nice day, bye-bye.